I became aware of the position, and I saw it as an opportunity to work at a higher level. It was a director position, so it was an opportunity to move upward into a higher level of management. I also saw it as a challenge. When you work a long time as a nurse, sometimes you get bored in the work that you're doing and you need a change. And they actually pay very, very well. All right, well, my position was I had a director's position. I was director of disease management. So I did not work at any one prison. I actually worked with the health services staff at all of the state prisons. So I would visit the different prisons periodically to try to help the staff best manage their inmates that had chronic disease. Inmates in general are not a healthy bunch. They have some pretty significant medical issues, and their health needed to be managed the same way that anybody else's health is managed. We wanted to make sure that they were getting the proper care for their conditions, that if necessary, that they saw the correct specialists to manage their health. So just like someone on the outside who might need a referral to go to a specialist, we also had to follow a similar process with the particular exception that when my patient would leave the prison, not only would they go to see a specialist, but security would also have to go with them to see a specialist. This is very costly. I enjoyed that I had a lot of autonomy. Nurses are very important to healthcare delivery for the inmates. It it's also extremely challenging because our patients generally are not nice people, and they have a lot of health issues. They're typically not people that want to take care of themselves. A lot of their health issues are self-created. So most people would not choose to be sick or choose to have an injury or choose to go to a hospital. However, sometimes my patient, the inmate, would injure themselves, would rather be in a hospital because for them it was less restrictive in a better environment than being in a prison cell. I think that they have to be confident in their abilities. It should definitely be a nurse with some experience because there's not a lot of medical oversight around the clock. You are practicing, fairly independently, and you also have to be able to set your feelings aside about providing care for people that are murderers and rapists and abusers, and sometimes that's very difficult to do that. But if you're going to be a nurse in that setting, you have to be able to put those feelings aside so that you can provide the best care to your patient just as you would anywhere else. I think that it is a good consideration for a job for an experienced nurse. They nurses who go to work in corrections, they can climb the ladder just like they can in other organizations. They can start as staff nurses. Sometimes within corrections, they have their own critical care units or they have their own urgent care units. But staff nurses can develop and they can become managers within health services and directors of nurses within that system, similar to working in any other type of area.